Yeah, so great question. When you were talking about your physician coming into the room with the laptop, and
Right.
because it was reminding me, my brother actually for several years, his job was to go in and train physicians on using their brand new EHRs, and the stories he used to tell at the dinner table when we go
Right.
out about his days were colorful, to say the least.
I bet they
right?
were.
So all sorts of different personalities. But as that happens and we get more and more data into the system, and even more importantly, as we get far more automated data feeds into the system, what one of the big challenges we're seeing is we haven't defined the data around the data, right? The metadata that actually defines what that data is, what its value is, what its value is to the clinician, what its value is to the end users. And without doing that, we run into those issues where there's this huge tension between costs, right, and holding on to data. I mean, you mentioned, Monica, about the vitals being tossed for newborns after a couple weeks or something like that, right? Because you weren't sure, and people weren't sure of the actual data of that particular information, right, or the particular value of that data. So trying to get that data, define metadata. Once we have that in place, then we can build engines, right? Then we can build data engines and medical rules engines that manage to keep the data where it needs to be for the length of time it needs to be, drive it directly out to the endpoint, to the end user, without massively inflating the budget. Because we could easily, we could spend the entire US budget just on storing the amount of data,
Right.
We're going to create. And so we need to be intelligent, though, about how we classify the data and how we store the data so that we can drive the most value. And I think that's really going to be one of the challenges. It already is a challenge, but I think it's going to be one of our biggest challenges over the next decade, is that data just continues to grow and grow and grow.
Yeah.